my name is Lauren Whiteman. I am a public health analyst with the Washington, Baltimore HIDTA, and today I am going to be speaking to you about ODMAP and its role with public health. Before we begin the specifics of ODMAP and public health, I just want to touch briefly on what exactly is ODMAP. It's a near real-time syndromic surveillance system for both fatal and non-fatal overdoses. It provides data sharing within and across jurisdictions, primarily to monitor for trends and spikes in overdoses. So one of the key components of ODMAP is its ability to provide spike alerts when the number of overdoses in a 24-hour period exceeds the expected threshold. So where does this data come from? Typically, it comes from public safety partners, and depending on the jurisdiction, this may be fire EMS, law enforcement, 911 dispatch, or OCME and coroners. And the data gets into ODMAP in one of two ways. So there's a manual data entry system. We call this level 1, and the data is entered directly into our mobile-friendly website by the designated agency. So the only data that is required is the approximate location of the overdose type, whether that's fatal or non-fatal, and then the naloxone administration. And this could be unknown, no naloxone, or single or multiple doses of naloxone. And as you can tell from those data entry points, there's actually no PII or PHI collected within ODMAP. The other way for data to be entered is through what is called an application program interface, or API. And this is an automated system that allows an agency's native record management system to automatically feed ODMAP. So we provide the coding, and then the agency is able to enter that into their record management system, and then they feed us data. So how is this data viewed? ODMAP agencies sign up for the national map. We also call this level 2. And this displays overdose data from across the country. The user can then filter that data for a specific state and or county, a date range, a time period, and they can look specifically at fatal versus non-fatals or naloxone administration to get a better view of the data. So how does this play in with public health? So first we have to look briefly at who is involved in responding to spikes. And it's really important for each jurisdiction to develop their own spike response team, as this can really vary quite a bit based on the resources and stakeholders within a given community. But anytime you're going to develop a spike response team, it's important to start by keeping in mind these persons at risk for overdose and keeping them at the center of your spike response team. And then this is an example of different stakeholders that can be involved. Today what we're focusing on is public health, so primarily your local and or state health department and the role that they may play. So I want to briefly mention the idea of public health prevention and prevention pyramid. So when we're talking about substance use disorders and overdoses, we want to look at the public health prevention pyramid under that lens. And for those that are familiar with this, this will be a bit of a review. But we begin with primary prevention, and this is stopping illness from developing from the beginning. So this could be really prevention-based programs like DARE that get into schools and try to work with kids. This can also be things like the CDC prescriber guidelines, which tries to limit or avoid prescribing opiates to people, which can trigger issues. Once we've gotten past primary prevention, we look at secondary prevention. And this is screening and early identification of illness. For instance, SBIRT, screening, brief intervention, and refer to treatment. So this is a model to try to identify folks in a medical setting that may have developed a substance use disorder and to get them some help. And finally, we have tertiary prevention, and this is stopping death or disability from illness. In the case of substance use disorders, this is naloxone. This is where harm reduction comes into play, syringe services. This is just basically stopping the bleeding. So where does ODMAP fall into this? ODMAP is a tool for tertiary prevention. It can identify and mitigate overdose spikes and prevent death and disability. So the spike alerts I mentioned earlier can serve as a catalyst for initiating a spike response plan. And the spike alerts can be utilized not just within your own jurisdiction, but can also be set for jurisdictions known to serve as source cities. So, for instance, in Maryland, primarily drugs come from Baltimore into the suburbs. So some of those suburban counties may be interested in setting up a spike alert for Baltimore, because if there's a high number of overdoses in the city, it's likely there's a tainted batch of heroin and it may be making its way out to the suburbs. So at HIDTA, we've developed an overdose spike response framework. And within that, there's some recommended actions for our public health partners. We're going to focus on a few of these today, such as determining a spike level, developing and deploying a PSA during spikes, developing and deploying a bad batch alert system, and targeted naloxone distribution. So before you can determine how to respond to a spike, you have to determine what a spike actually looks like for your jurisdiction. So ODMAP provides a suggested spike level based on the data that's entered for a particular jurisdiction. We use a formula of 2 standard deviations above the mean. Again, this is a recommendation. So if a jurisdiction doesn't feel like that is an appropriate value, they can set it for whatever they think is right. And you can see in our bar graph below, this is from our weekly reports that are available. You can see these days in red are days that have had a spike. We also have the ability not just to set spikes for a county, but particularly in larger cities, we know that what is normal and typical with regards to number of overdoses can vary a lot across the city. So this is an example. This is from our test environment, so this is all fictional data. But within Baltimore City, these are the police jurisdictions. So we can actually set spike alerts that differ by particular police jurisdiction if we know that certain areas of the city are prone to have higher numbers than others. So public service announcements are really important during spikes, getting the word out to the general population. So some of the information that's important to include might be signs of an overdose, what to do if someone is overdosing around you, where to get naloxone, just some information on your local Good Samaritan laws. It's important to keep this information fairly general. You don't want to provide any specifics with regards to the suspected drug that could be causing this spike, because there are those that are at risk for overdose who might be driven to find that. And PSA should also target channels that reach people at risk for overdose. So it's important to do some local research, speak to folks in recovery, speak to folks who are still in active addiction, and try to determine who is a trusted source of information and how to get information out from that source. For instance, persons at risk for overdose might be more willing to listen to information coming from the Department of Health versus police. So another way to get the word out to those at risk for overdose is to come up with some sort of bad batch alert. So using the information provided, you can actually get the word out directly to those at risk for overdose. One example of this is Berkeley County, West Virginia. Their Day Report Center developed an automatic text alert system for clients. So what happens is that when a spike alert goes out, it goes to a generic email for them, and then that email triggers this text alert that you can see on your screen here. And this actually just lets the clients that want to know that there might be tainted heroin in the area, that if they or a loved one is using, to be cautious, keep Narcan at home. It also provides some positive reinforcement because these are folks who are currently seeking treatment. So it reminds them how to get a hold of their peer recovery coach, harm reduction, all of that information to try to assist them and encourage them to stay on the right path. Finally, the other component that's important is targeted naloxone distribution or targeted harm reduction. So ODMAP can be used to identify hotspots, so areas where there are a lot of overdoses occurring. So for instance, in Virginia, their naloxone trainings are called Revive trainings. And these can really be targeted to areas where you see a high volume of overdoses. Again, this is just some fictional data here, but this gives some suggestions of areas where you may want to target to do a revive training. Maybe you have a needle exchange van and you want to know where to send it. Looking through ODMAP can give you this information. And finally, once you've implemented a program like this, it's really important not just to do this all in a vacuum and never look at it again. So these are a couple examples of different evaluation cycles. But primarily what they say is that once you've implemented a plan and you've done it, it's important to then study the data and the results of that and to make some adjustments to your plan as needed. So nothing should just be put into the field and then never looked at again. It's important to constantly reevaluate. That is it for ODMAP and public health. Thank you so much for taking the time to listen today.